index? What's a desirable number, a high number or a low number? High number. It's always been high number. We just have to prove it arithmetically here, right? Next. I'm not going to put viral families on this test. I'm not going to put antiviral drugs on this test. But I need you to know about them a little bit. You ready? Anybody ever heard of Tamiflu?
Yes.
What does it do?
When my daughter had high temperature and, runny
Flu?
nose, they
Influenza?
wanted to give her Tamiflu. Yeah.
Okay. They say that Tamiflu will help alleviate the effects of influenza, and it's not true.
It didn't do anything.
It doesn't do anything. It doesn't do anything with any patient I've ever given it to. The manufacturer says that you should take Tamiflu when you get the very, very first inkling that you think that there might be a chance in the future that you might get sick.
Wow.
By the time you have a fever, and I mean low grade, I mean 99.5, Tamiflu isn't going to do anything for you. A little bit of a sore throat, or even so much as a little bit of a headache, too late for Tamiflu. So that's the truth about Tamiflu. But when we think about other antivirals, we have to think about some drugs. And by the way, when it comes to Ebola, which is enveloped, by the way, when we think about Ebola, do you agree that they're working on a vaccine right now? Now, they're not working. These are antivirals. These are not vaccines. We'll get to vaccines next. But if you were going to try to get a cure for Ebola, so now we're talking about past vaccination. Now the person has tested positive. Now you're going to give them a drug to try to cure them. Do you agree that one of these three families or one of these three things are what you're going to try to go after?
Yeah.
Either to inhibit the entry of the virus, because remember the virus does what? It gets into the host cell, doesn't it? Or inhibition of nucleic acid synthesis, or even the inhibition of release, correct?
Mm-hmm.
Or even a protease inhibitor, but it doesn't use protease inhibitors. These three families of drugs are the three families of drugs that are used for HIV patients. When it comes to HIV patients, you either give them one drug out of every family, or two drugs out of every family, or two drugs out of one or two families, or any combination of that. All infectious disease specialists do it differently. So these are the three families of drugs that